The doctor is in. Dr. Marc Pietropaoli from Victory Sports Medicine and Skinny Atlas is here to talk to us about the doctor-patient relationship. And it's one of those where you can love your doctor, but you can become annoyed. And I'm sure you can too with demanding patients. And so we're going to create a little understanding here, right?
Yeah. Are we really?
Yeah.
Yeah, okay. We'll go through some of these questions here. A lot of people feel like they're being rushed. You know, they wait a long time, then they get in. It's like, okay, thank you, take your blood pressure, see you look good. Why?
What do you think?
What do you think of that?
If you feel that way as a patient, what should you do about it?
Do you want to know why that happens?
Yeah, tell me why. Because it's a job for you?
I think there's a lot of, I think there could be, I can go on and on, there's a lot of reasons why that could happen. Now, I can speak for myself, hopefully for some other physicians as well.
Sure.
I'd like to think that my patients don't feel that way, but inevitably you're going to have times when the patient's going to feel like you didn't spend enough time with them or they were rushed. And sometimes they are, sometimes they aren't. I think in my practice, we try our best to space the patients out as best as we can.
Yeah.
We even meet in the morning for 15 minutes to kind of discuss the daily schedule. But sometimes even having said that, we'll have an emergency that comes in and that kind of might throw your whole schedule off. And I think, you know, the other reason it's kind of taboo to talk about is that it really is a business and we run a business. And, you know, if you look at the paper this morning, you can see that Excelis and other health insurance companies are raising their rates again.
Yeah.
And they're trying to cover the high cost of health care, which is very high. And we still have the greatest health care system in the world by far, but it's expensive. So they're trying to bring in more income and lower their costs. And, you know, they've paid the hospitals, physicians, healthcare facilities less and less as time has gone on. So you're trying to make up for that. You want to be able to pay your staff a competitive salary. You want to be able to give them cost of living raises, things like that. So it kind of is a balance, and I think a lot of physicians have felt pinched to try to see more patients in a shorter period of time.
That you need to get, it's a business, you need to get people in and out of there, and not for lack of caring, you wouldn't get into this. You don't get into being a doctor for just the money, okay? I mean, there's like, it's a special person. I
mean, I can guarantee you there's no doctor, or there's very few, I'm sure, who want their patients to wait or want to, you know, rush their patients. If you could sit down and talk for an hour with your patient, it'd be great, but the reality of it is that you can't do that with everybody.
So there's a lot that goes on that people don't realize. That's why they're waiting, and because maybe something, like you have a patient in there and there's something that unexpected, so somebody else may have to wait. But I think this would be a great idea, because I know when you ever go to the doctor, you always think, before you go, you think of all these great questions. But then when you get there, you lose them all. It's probably a good idea to put a list down, right?
Yeah, I can't tell you how many times patients will tell me, you know, Doc, I forgot what I was going to tell you, and I tell them, you know, write it down, and if you remember, just call us back and ask us, or, you know, make sure you write things down. I think that's really important.
That brings me to another one, the calling for the doctor, and I understand that a lot of times, and I have relatives who are nurses and friends, but I don't always want to talk to a nurse. I feel like I've already talked to the nurse twice and I want to get to a doctor. What is a reasonable expectation? Should a doctor be able to call you back? Sometimes I feel like you can't get through a receptionist to get to a doctor, because I think they realize how crazy these guys are. Busy meaning crazy.
Well, there's a couple things there. It depends. I mean, my nurses are the best nurses you can ever possibly have. So,
I do know your nurses. They are great.
They really answer a lot of questions, and they're very, very good. And anything that they can answer, and a patient wants to speak to us, we'll always do that. But I think it comes from, we're very lucky to have continuity in our staff. We have great nurses, great receptionists, and if they can be friendly and try to answer, and a lot of the questions are simple questions that don't need the doc, but the patients don't understand that. But it's reasonable to expect your doctor to call you back if need be.
So don't expect your first call. I mean, if you've got a basic call, but if you have something that continues to go on, it is reasonable to expect to talk to the doctor.
Sure.
But don't expect it right at that moment, because they're in the middle of stuff.
That's tough sometimes.
So give a time frame. At the end of the day, call, be reasonable, and that would be.
Give the guy some slack. Okay? Give the man. And eat your vegetables. Maybe you won't have to go in as much, right?
My gosh.
Exercise too.